So, Dr. Horowitz, let's talk about the healing process of a tummy tuck. What does the patient experience when they go home from the surgery?
Okay. So new things that we're doing. There's always new things.
Yay!
So new things that we're doing. So I call this Drainless, Painless. So it's not painless totally, but there's less pain.
Okay.
And what's happened is there's been a newer medication called Exparel, which has become available in the last few years. And Exparel is like a Novocaine. It's a topical anesthetic that could be injected into the skin and the muscle, but it lasts for 3 days.
Wow.
So if you go to the dentist and you have an injection, you know it lasts a few hours. And that's all that was available up until recently. So up until recently, what we did was we would use pain pumps. And a pain pump was a small, very fine plastic tube that we would place under the skin, over the muscle. It would stay in place for 3 days and drip in a type of Novocaine and a local anesthetic for 3 days. And that worked pretty well, because for 3 days the patient would have much less pain. Now with Exparel, we could do the injection at the end of the operation, not use the pain pump, and when they leave there's no pain pump, there's no plastic tube, and they have that same 3 days of relief while they're healing. So that means they need less pain medication, they can move around easier, their recovery is quicker. The second part is I've stopped using drainage tubes. So typically after tummy tucks, we use plastic tubes that would be placed after surgery. And the drainage tubes would collect a small amount of blood and fluid that would sometimes accumulate after a tummy tuck. But a number of other surgeons stopped using these in the last few years, and I've followed this very closely, and their results seem to be the same. And so I started to do this or provide the service for my patients. And there's been no downside. My patients, and the upside's been, the patients leave, they have no drainage tubes, they don't have a pain pump, they just wear a girdle when they leave. It's easier for them to get up and move about. And nobody has ever liked having plastic tubes coming out of their body after surgery, whether it's a breast operation or a tummy tuck. So the patient's been really very happy with this change.